A pleasant good night, everyone. Seeing you all for the first time for the year, so I could safely say Happy New Year to you all, and of course, Happy Independence, because we're celebrating still. It's a year of
Yes.
celebration. So it's safe to say Happy Independence, and of course, well, Happy Valentine's as well.
So, thank you, and same to you, sir.
Thank you.
Right.
Thank you. It's a lot of big deals, right? A new year,
Definitely.
50 years, Valentine's, love everything.
I know.
Yeah.
Um, so today we want to, it's our first, well, first discussion with me, but not the first discussion for GrenCHAP for the year. But today we want to focus on exploring the impact of unresolved childhood trauma on mental health and relationships. Another very important topic, and of course we can't forget, last year we focused on the what we consider to be the adult component, but of course we can't forget the childhood aspect of things. So I want to start things off by asking the question. Well, I shouldn't ask to introduce yourselves because I'm sure the persons who are viewing is very much familiar with the faces and the name to the faces. So let's start by asking the question, how do unresolved childhood wounds influence an individual's mental health later in life? And I could probably start with the lady in the room first.
All right. So thank you, Kishawn. I think before we attempt to answer the question, maybe we could sort of like set the stage talking about unresolved childhood wounds, right? So right now we're talking about trauma. And I like the way one of the world's leading expert, Dr. Geber Mate on trauma, how he described trauma. He says it's the invisible force that shapes our lives, right? It's the way we make sense of life. How and the incident that happened, it's the way it shapes our lives. It influences the way we think. It influences the way we act and we behave and how we love and how we form relationships, right? So trauma really is not so much the thing that happened to us as much as the internal processes that take place as a result of trauma. And you ask about the early childhood wounds. So trauma, it's a Greek word, and by definition, it means wound, right? So when we think of trauma, we think of wounding. So another context I just want us to put the discussion in is to say that terrible things do not have to happen for somebody to experience trauma. There could be uh, the parents are there, but they're not present in the child's life, or they were not present in the child's life. So they're not emotionally available to him or her. And they're so stressed, the child is feeding off of that. So there is no attachment taking place, there is no hug, there is no love, there is no attention. All of this could contribute to trauma as well. So not only the assault or the physical abuse or the sexual abuse and things like that. So I just wanted to say that in terms of setting the context. Now, to answer your question, how does trauma impact early childhood and how the wounds influence the individual's mental health? Well, of course, if I have experienced trauma, depending on the type of trauma and the messages and how I internalize what happened to me, the messages that I receive and that I give to myself would impact my mental health, right? So it would impact how I feel or how the child feels about himself or herself. It would impact the child's attachment style, right? So if the parent was available and if the parent is there, then the child would be secure. But if the parent was not available, then the child would have all these sorts of avoidant behaviors. They would have all of these insecurities, and all of these things would negatively impact them and subsequently their relationships. Mr. Stroud could, add some more of that.
I will just, what should I say? I'll just put a little cherry on top of what that wonderful cake that was made. Listen, one of the things that we have to keep in mind when it comes to trauma, as Mr. James indicated, that terminology wounding. And the issue with it is a wound that in most cases you cannot see. If a child gets cut on the hand, you could put plaster on it, you could put all the different things, the gauze, the spirits, the rest of what's of it. Yeah, you might see some marks, and that mark is important. We're going to come to that in a little bit. You will see the marks because according to how deep that cut is, you'll be able to see those type of blemishes that may last a very long time, may stay with that person until they die. Here's where the issue comes with trauma. It is a hurt or is a wound that cannot be seen. It is a wound that you don't have, if not treated or not taken care of, the right plasters are not put on, so to speak, the right type of treatment is not given. We are talking about a wound that will not just only have a scar, but we're also having a wound that is going to prolong for possibly the individual's entire life, unless some resolution is taking place, has taken place. So I think that's the fundamental principle in that, within the context in which you would have asked the question. Yeah, that's the only thing I would add to.
Okay, and how can you explain or can you explain how childhood trauma affects the formation and maintenance of healthy relationships?
Well, see, the thing here is, as Nicole rightly said, it all depends on the type of trauma, or it all depends on how severe. Let me backtrack a little bit, because an event is traumatic to a person based on their perception of the event.
Yeah.
You and I could look at something, look the very same thing, and we will have a totally different perception of it. There's a tree outside that you and I would look at. You will see a beautiful tree that is that brings ambience to the community. I will see the middle of it rotten, and I will fall on somebody's house and I will kill someone. So trauma is based on perception. So we need to get that. So based on the perception, based on the interaction and the experiences, trauma is determined. So and basically that wound comes about because I perceive it to be possibly a harming an incident. So any type of interaction that I have that the body, the mind perceives that could bring some form of harm towards me as the individual can result in trauma. And so when we're talking about the forming of relationships, and we're talking about having lasting relationships, you're also talking about, is that individual in a place, or the type of trauma that they would have experienced, is it related to relational type of behavior? And so based on that, so if I again, the probably popular ones of the sexual abuse and those kind of things like that, that people tend to associate with trauma, and Nicole is very right, they are all different types. If that is something that I have experienced as a child, you could understand, if not addressed, this is a wound that I will go along with. And so my perception of possibly the opposite sex, or even in some cases, the person of similar gender, they may create issues because of that type of hurt that we have been caused by this particular individual or this situation or circumstance. I associate anybody or any situation or circumstance related to that as going the same way that it went when I was a child. And so if you have that particular mindset and you have that particular perception of individuals or experiences, you will not go. So for example, a child finds him or herself, maybe, children go and they explore and they find themselves trapped in some place. The possible trauma that could cause, yes, the child may have been rescued, but that lingering scar, that mental lingering scar can go along with that person for the rest of their lives. Anytime they're in a very closed environment, forget it, they are going to fall apart because it brings back the memories of what happened. And so that is how basically it works in terms of that. Nicole, I'm sure there's more that you can add there.
You know, I just want to continue with the word wound that you use, right? And if we look at trauma as a wound, and to help our viewers to situate themselves in what we're saying, when we have a wound, if it is open, every interaction with it would hurt, right? It would create some kind of pain. It, depending on the interaction, it may even infect it and make it worse. So the wound, we're looking at the spill off and the kinds of relationships that we get involved in. The other aspect of looking at the wound is that when we have a wound and it closes up, no, so the person with the open wound could be excessively sensitive and needy and clingy, or everything affects them. And so in their relationship, the behavior looks in a similar way. The other way of looking at it, Kishawn, is that if the wound is closed, then it develops tissues and scarring, right? With the tissue, it's less sensitive and sometimes you're not feeling, right? And then we find some people in relationships, whether it's intimate or just casual relationships, that they numb themselves. And numbing is a coping mechanism, but it's not necessarily a healthy coping mechanism. It's what we use to protect ourselves. And when we numb, we're unable to feel. The danger in this is when we numb as a coping mechanism, our emotions cannot make the distinction between which emotion we wanted to numb. Because we numbing because the pain of the disappointment or of the lack of connection and the detachment, we can't sit with it. So we're numbing for that reason. But our emotions can't distinguish between painful emotions or happy emotions. And so when we numb and we're in relationship where I have unhealed and unresolved trauma, but I'm in a relationship with Mr. Stroud and he's giving me the healthy things that I need, the trust, he's allowing me to express myself. I can't receive this. I'm not used to this. So you see how it's impacting the relationship once it is left untreated, unattended to.
All right.
And not only is it difficult to receive or sometimes impossible to receive, the individual is on the receiving end can sometimes fight back against it because it's so unfamiliar. It's almost threatening. And so I just wanted to add on that little caveat there. Yeah.
Yeah.
And I want to ask a question because the viewers might be asking whether or not there are specific types of childhood wounds that are probably more significant than others. And of course, it can have that impact on mental health outcomes. So are there any specific types of the childhood wounds? Because we spoke about the wounds a lot, but are there specific types that we can link to say, okay, there are most significant impacts, or these are most significant impacts as it relates to mental health outcomes?
Okay, so the answer is yes, right? So when we look at the childhood traumas such as physical abuse, what messages do the children get, or we as people get when we're beaten, right? And sometimes severely, right? I am not an advocate for the beating, but sometimes we know there are some beatings and repeatedly, it's happening to the child, right? The person becomes fearful. And there are times when not only become fearful, but some of them learn to believe that if somebody loves them, the way of correcting them is to beat them or to be abusive to them because they have seen it, right? Another type of trauma that could be create that significant damage, of course, is the sexual trauma. For some people, they have to live with this for a lifetime as a secret, unable to say to anybody. There are those who have said it and nobody believes them. So if nobody believed you, what messages did you give to yourself as a result, right? And another form of trauma that could be more impactful on a child, some children in vitro, they experience trauma. The parents may have been dependent on alcohol or some other drugs. So from then on, maybe they have gotten damaged, brain damaged, developmentally, they have not been able to experience, the full range of things that they're supposed to do or ways they're supposed to think as somebody else whose mother was not exposed to that kind of experiences herself. Yeah.
Bro, do you want to add anything to that one?
No. The only thing I would say is that, as I said earlier on, and everything that Nicole said, I mean, there's no argument here. The only thing I would say, is that again, it's perception. A lot of the times, the perception has a lot to do with how I read it. Okay, now there are some, as Nicole said, there are some things that are, not about perception. You were hurt. But again, trauma has a lot to do with how you perceive the activity, and so, because there are some who will say, oh, thank God for that, and as opposed to, yeah. So, but other than that, yeah, that's really add on to that.
All right. So we want to kind of to draw the curtains a little bit more as we spoke about the wounds, the different types. But also we would want to know, would those types of childhood wounds be the same for people who are marginalized, like the LGBT disability, children born with HIV, and so on? Would those types of childhood wounds be the same for these marginalized groups? And can you expound on the differences?
I would chime in here first to say that simply because of how we are socialized and some of the cultural biases that we have, what you will have is compounded trauma. So we already have the issue of being a marginalized community. Then if that now is compounded with additional trauma, then understandably, it's going to be a bit more severe and more work to be done in order to recover, as opposed to someone who, based on culture and so, fits a particular script. So I would say that yes, to a certain extent, yes, there is definitely the possibility that it's going to be a bit more. It's going to be definitely more compounded because there's already the possible trauma for feeling the sense of neglect, sense of being seen as not belonging, and those kind of things like that. Those things for themselves can cause trauma for some people. Additional to that, then somebody sexually abuses you, and so you understand the complications that come with that. Yeah.
And I don't know, you made the distinction, and I guess I get why you made the distinction, but I want to just add here that anybody from the LGBT community or somebody born with HIV, whatever the labels are, they're first human beings. So anything that affects the average human being would affect the average human being, right? So I just want to put that out there.
All right. Well, it leads me to, I try to make the linkage now. Can you discuss the link between childhood trauma and conditions like anxiety, depression, and PTSD?
So go ahead, Mr. Shaw.
Well, I'll start with post-traumatic stress. You would appreciate that, especially during the 1960s and 70s, a lot of persons were not cognizant, especially within the field of psychology, as to what exactly what PTSD was, post-traumatic stress disorder. It was not until after the Vietnam War, when some significant research was done, late to middle 70s, that, you know, seeing guys coming back from war, because for years, and I'm trying to give you a background of where post-traumatic stress came from, coming back from war and so, and uh, and they would have done some significant research in understanding from previous wars. Men will come back, and I say men because predominantly they were males in those times. You know, will come back, they can't function, they can't fit back into society, having a lot of nightmares, hallucinations, can't sleep, can't hold on a job, all of those things like that. And it had happened for years. But it was only until after the Vietnam War that they would have done some significant research to understand what was happening. And then you had the coining of the term post-traumatic stress disorder. So it was through the military that, you know, research and psychology really got an understanding as to what PTSD was taking place. And then as the research continued, there was a realization that any form of trauma, and of course you will understand what trauma is like, but I shouldn't say understand, you would appreciate what the type of trauma that could occur on the battlefield, seeing men die in front of you, losing their limbs and all those kind of things like that. You would understand having death so close to you, you being susceptible to the possibility of dying yourself and coming out of that. It's difficult for somebody to just fit back in and say, oh, yeah, everything is all wonderful. And so what the research has indicated as time has gone on is that, hey, listen, any form of trauma can result in post-traumatic stress, because that is what it is. Is after the trauma, after the stress, you have something of a syndrome that you go through to somehow kind of basically work yourself or process yourself out of it. Now that can sometimes take a very long time. It takes a significant work. It takes a lot of hand-holding sometimes. And so post-traumatic stress in terms of trauma is basically the syndrome that a person goes through as a result of that trauma. Now, the very good thing about it, and people may not see it as a good thing, but the fact that somebody is going through post-traumatic stress is also an indication that the brain is beginning to tell that person is trying to start to step out, and time to start to change, time to start to come out of that. But of course, after being so accustomed to a particular orientation and a particular situation, the brain has to reacclimatize itself, and that's its way of trying to compensate for all of that. So I took that one because I think you would recognize that, for example, a lot of persons would have suffered post-traumatic stress after Ivan, and I'm certain, and here's one of the big caveats with that, in that in a lot of cases, the symptoms or some of the outward or those overt type of behaviors that are associated with it do not really show themselves until about two or so years after. You don't really get to see the real thing. So you would understand what the possibility is in the next possibly year and a half or so from COVID. So we have to pay attention to some of those things that could have come out of that. And so with a lot of the results of the post-traumatic stress that will be associated with COVID isn't going to start to really truly show itself. And I'm just bringing that as an example until about a year and a half or a little less from there. So I just wanted to put on. So that was the one that's the one I wanted to make sure I spend some time.
Okay. Brenda, you have anything to add on that one?
Well, in terms of, you asked about depression and anxiety, and then Mr. Strode articulated the PTSD really good, right? In terms of the anxiety, and he used the example of COVID. Now, the WHO, the World Health Organization, they have statistics now showing that there's a 25% increase in anxiety and depression, especially among women and girls, and so after COVID, right? And we're talking about the link between trauma and mental health issues, anxiety and depression, and so. And you would appreciate again during that time how children had to move away from the normal way of functioning being in school with their friends, right? Playing, running, too. They can't even go outside by the neighbors. They can't do anything. Even adults, some people lost their jobs. Some people became so overly concerned about what's the word, contracting COVID, right? So they became anxious, washing everything, spraying down everything, sanitizing everything. In terms of the depression, some people lost family members, close people. Some people lost their jobs. All of these things over a period of time took a toll on them. So that's sort of creating a picture of how these mental illnesses could be linked to trauma.
One of the things that we also have to be aware of is the possibility of obsessive compulsive type of behaviors
Yeah.
can as a result of trying to cope. That's one of the
Yeah.
coping mechanisms that come as a result of trauma. So persons have learned that when they believe, and sometimes it's very maladaptive thoughts actually, they believe that if I do this way, and that way, then this thing would not affect me in this way. And so they've convinced themselves that I need to walk this very thin and line of behavior and conduct so that this won't happen to me. And so they become very obsessive in the way that they operate. And so that's one of the fallouts from having to deal with trauma and some of the possible mental health issues that can come about. I want to just add on that.
All right. So I want to switch my attention to how do individuals often cope with unresolved childhood trauma? And are these coping mechanisms effective? And it's a link to another question that includes in terms of the role of counseling and therapy. So, how do they actually often cope with the unresolved childhood trauma, whether or not the mechanism are effective, and the role that therapy and counseling normally play in addressing the healing unresolved childhood trauma roots?
Nicole, go ahead and take that one.
All right. Well, I mean, anything that impacts us, we react to it differently. Individuals react to it differently. So we all went through COVID, which was traumatic, but our responses to it could be, it's varying, right? So the same is true for trauma. No, but generally, some people's coping mechanism are unhealthy. So for some people, they may turn to alcohol and other drugs to just distract them, numb themselves, and so. For some people, they engage in risky behaviors. Some learn to, they feel like for the condition of worth is like, I have to please people. I have to do things so that they could like me, because that's the message they received or they give to themselves after experiencing the trauma. Or for some, they have to do everything well, like so develop this kind of perfectionistic ways of doing things. All these are coping mechanism, ways people have learned to protect themselves, but they're oftentimes dysfunctional, right? Because they cause even more stress to themselves. So the other part of the question, you're asking what is the role of counseling? Well, it has its role, and that's the part we're excited. That's the part we're excited about. Therapy provides a safe and a brave space for people to express themselves, because part of the trauma sometimes is that people do not have that luxury, right? Or that opportunity in some cases, right? To express themselves without being judged, without being labeled as wrong, or saying that you caused it if you didn't do this, if you do that, if you didn't do that. It's just a brave, safe space to express themselves. In therapy as well, the person has the opportunity to process the traumatic event. So what do I mean by process? We talk about it. And as we talk about it, they're beginning to gain insights. Are they beginning to gain self-awareness, understand how the thing that happened to them is impacting them internally and not necessarily externally, as Mr. Stroud used the word. It's invisible, right? That's what trauma generally is about. Another thing that we do in therapy is to help them challenge their beliefs, right? So they may have what we refer to as a maladaptive beliefs. If the person loves me, then they would beat me, right? That's maladaptive, but it's coming from somewhere. That person may have been exposed to trauma in their childhood. The physical beating, the corporal punishment, rather, is what I want to say, are being exposed to domestic violence, right? So they've told themselves these sorts of stories that it's okay, he loves me, that's why he beats me, or she loves me, that's why she beats me. They learn coping skills. So we steer them and help them. And therapy, I must say, it's empowering, right? We do not have people coming to therapy for life. We want to empower them so they could move from survival mode, because that's what happens to people who are living with unresolved trauma. They're in survival mode. And we equip them with the healthy coping mechanisms or skills to move toward thriving and living a better life.
It's often said within the field of psychology that the therapist is supposed to be a mirror.
Yes.
And that analogy, I think, is what I want your viewers and your listeners to really take, because that's what therapy is supposed to really do. That's what the therapist's role is. Therapist's role is not to tell you what your problem is. What the therapist is actually supposed to do, or is supposed to facilitate, is a process where you can verbally and sometimes actively demonstrate what is happening inside of you, and then the therapist reflects it back to you, so that maybe for the first time in your life you actually get to hear, or you become conscious or aware, that word that Nicole used a while ago, of what your true situation really is. And so that's the role of therapy. There are different modalities that therapists can use in order to be able to get some of that done. Again, if there are some practical things that are necessary, you can use a behavioral cognitive behavioral approach. If it's just about giving a person an opportunity to just talk, you can use a free association type of modality. And most persons who practice in grade are practice from an integrative perspective. You don't have person centers. You don't have, most of us, we because of our training, thank God for that. I think most of us have been exposed enough to each of the different modalities that can give our clients enough that we can allow the clients in an indirect way that we can go with you where you need to go. All right, and you work from there. So that's pretty much what it does.
And can someone identify if their current mental health struggles are rooted in unresolved childhood trauma? And if they can identify that situation, are there strategies and interventions that that said individual or even their family or friends can implement to begin healing from those trauma on their own?
The on their own part is sometimes the tricky part, because unfortunately, as the code articulated a while ago, sometimes most of the coping mechanisms we use are maladaptive. It is advisable to get structured support, and that's where therapy comes in. And this is not just about, this is really, and it is, I think for us in a lot of cases, the human is like that. The human wants to find its own way, and that's okay. There's nothing wrong with that. People look for and can find different ways, and you can identify in some cases because it might be present for you, but there are some people who don't know. It's something that triggers it, some other event that was very similar to what may have caused the trauma in the first place that may have triggered it, and then you realize, well, where is this coming from? Why am I behaving this way? And so it's not until you really get that kind of structured help that will guide you through the understanding of where this thing is coming from, And so while, yes, a lot of us have the strength, the mental strength and the support in family and persons we can talk to, there comes a time when you need a kind of you need structured processing to be able to get over that last hump, so that you would make sure that you get, the stuff resolved. So yes, of course, there are things that persons can do. We spoke about some of them. Having support around you, letting people know what's happening with you. This part that you're struggling, don't hide it, don't keep it to yourself. You have people in your life that you can trust. You talk to them, you let them know. But there comes a time, according to the severity of the trauma, that you're going to need structured help to be able, structured support to be able to do that. And that's where the conversation comes.
No, I just wanted to add that to begin with, Kishawn, if the person could have done this by himself or herself, we were not going to be having that conversation, right? It's complex, right? People could do certain things on their own, but even us in our field, some people specialize in providing trauma care, trauma-informed, as they would say, trauma-informed care to their clients, right? So basically, the only clients they see are people who, struggle with trauma. You asked if there are, that's the part I just wanted to add a little bit to, if there are some signs or things that they could look for. Yes. And that's why that is why it is important to be self-aware. See how you're changing or how you have changed, right? So once there is difficulty trusting people, we know something is wrong there. And not just a difficulty trusting somebody because yesterday I shared something with Mr. Stroud and he repeated it, right? It's like over a period of time, from maybe since you were a child or for so many years, there isn't anybody in this whole good world with somebody that you can trust, right? In terms of looking at the patterns of dysfunctional relationships. So you may hear some men and some women making statements like, I don't know how others end up in these situations, right? But there is a reason why you end up in these situations. It's a pattern. There is something, it's like Wi-Fi. There is something that you lack that you're drawn to that kind of people to get, or there is something that you're so familiar with that you're getting from that kind of person. Unexplained panic attacks or anxiety and unexplained feelings. Like sometimes people just come to therapy and I don't know what happened. I just there and I just start to get frightened. I just get in a panic attack, right? Behaviors or experiences like that. Even difficulties setting boundaries, right? Some people do not know how to set a boundary to prevent and to protect themselves, or how to be assertive enough to say to somebody, you're crossing a boundary, right? These are some of the things that, our viewers could look for. Again, the self-awareness. How am I changing? How have I changed in these ways, in these patterns of behaviors?
The self-awareness part is important because what awareness does in a therapy session is that it brings the client to a place where you are cognizant of the issue, and you know that the client has to determine, are you going to continue with this role or am I going to change onto this role? And so that's where self-awareness. So self-awareness doesn't make you change, but it brings you to the place where you are in front of you, the mirror comes and you see, oh, wow, am I comfortable with this? Is this who I want to be, continue to be? Or am I going to take another path? Yeah.
Can I just add something that just came to mind?
Sure.
So Kishawn, there is something called somatization, right? And simply put, it's just physical symptoms, right? So some people may go to doctor and they say they're having stomach pain and they've been having this pain for so long and this chest pain for so long, and they do EKG, That's what it is. They do whatever the things are, and the doctors are saying, they do blood tests and all of that, and the doctors are saying, but nothing is wrong. Everything is functioning, right? What is happening there is that the trauma and the whatever is going on is psychological, right? But it's presenting itself in the form of physical, pains and chronic headaches and all sorts of these things. So that's another thing that it's very common, right? And that our viewers could look out for as well.
All right, as we wind down on the discussion, the word of advice you would have for individuals who are struggling to overcome the impact of childhood trauma on their mental health and relationships. People would be there and, what do I do? It's easy to tell me go to a therapist. What are some of the words of advice would you have for individuals who are struggling to overcome this childhood trauma challenge?
Okay, so I'll go first. I'll let the lady finish. Listen, trauma, as we would have indicated, is in and of itself not the easiest thing to work with, to deal with, to handle. And so while I understand that someone may very well, feel, listen, I need some things to do, I still want to reiterate that I think it's very necessary for that you get structured help when it comes to that. That's important. However, what are some of the things that one can do? Seek support, be open about what you are feeling and what you are experiencing. You're going to have to find somebody that you trust. In a very small space that we have in this little piece of the rock, sometimes that's a very difficult place. Difficult thing to find because we're so small. Be careful who you speak to about the stuff, because sometimes, as therapists, sometimes we have that problem. You give your client unconditional positive regard, we give them genuine and the outlook and all of those wonderful things, and we have the confidentiality, and all of a sudden they come to you and you tell them they say everything and they express, they free associate and everything, but only to know that they've told 5 or 6 or 7 other people, and then you wonder and somebody say the counselor, that's what, those kind of things, and so we have to be aware that we got to be very careful about things. So be careful and choose the kind of persons that you would, tell the things that you have that's happening with you. But at the same time, you would have, when that time comes out, that individual, you need to be open. You need to be, frank, express how you feel, be genuine in terms of how you express your feelings. And to me, that's what I would say. I still hold to the fact that according to how severe the trauma is, you're going to need structured help, and it's something that you're going to have to really pay attention to. Though you may not want to, it's something you have to seriously do. Yeah.
So I am going to begin and where Mr. Stroud end and repeat what he said. If the person could have dealt with the trauma by themselves, we were not going to have that conversation. So they have to seek professional help, right? But there are some things that they could do, and dealing with the trauma first begin with acknowledgement, acknowledging that I have a problem. Something is not happening, or some things are not happening the way they're supposed to happen. So the person has to be able to acknowledge that I need help and I have a problem. What can they do? Educate themselves. You find, Google, I call him Uncle Google, YouTube, TikTok, all of these places, although they have to be careful with some of the information that they're reading, because all sorts of people put all sorts of information out there, right? But educate yourself. Find out, maybe when you go to the doctor, ask some questions, okay? Practice self-compassion. That's a way to deal with it, right? There are some people who experience certain kinds of trauma, maybe sexual trauma, or especially sexual trauma as children, and they blame themselves. right? So practice self-compassion. Challenge your negative thoughts. Challenge it by weighing it, balancing it with facts. Are the things that I'm saying about myself true? You know, take baby steps in healing and growing and changing. Be patient and be persistent in what you on your journey. Because Mr. Strode said it earlier on, it's not an easy process. It's a complex process, right? And the way one person responds to a traumatic event, you may not respond to it that way. And this is why you have to give yourself grace and you have to practice self-compassion. And I just want to end, Kishawn, by saying to individuals who may be struggling with unresolved childhood issues, you're not the trauma that you experience. You're way more than that. You have skills, you have talents, you have strengths, you have abilities, and these are the things that we use in therapy to help you cope and to help you walk through, not get over, the traumatic experiences that you have had. Yeah.
Right, so I want to say a very special thank you both again for taking the time off. It was a very fruitful discussion. And of course, a lot of the information that came out of it, especially all that has been happening recently, who knows, probably the next couple of months from now, we may just hear the whole issue of childhood trauma coming up again, and might just be the responsible thing for what's been happening. Who knows what's going to happen? So let's hope the conversation is accepted as it normally does, and someone somewhere out there would be able to get some food for thought from it. So again, thank you so much. And of course, the year has just started, so I'm certain that we will see him again. So
certainly.
So have a good one, and thanks once again on behalf of GrenCHAP and the funding partners. Thank you both for the time.
Thank you, and bye.
All right.
All right.
Take care.